Hi, this is Gina Tizio. I am a licensed naturopathic medical doctor in the state of Arizona, and I wanted to talk to you a little bit today about the MTHFr gene mutation. Before we proceed, as usual, I'm not giving medical advice. Anything I say is not for the purposes of diagnosing or treating any medical condition. So there are a lot of people out there and they exercise and they do their weights and they do their cardiovascular and they keep their mental and emotional health in line, and they eat a whole foods diet, meat off the bone, a lot of vegetables, unprocessed grains, and they avoid processed foods and man-made foods, and they have clean ingredients. They avoid toxic cleaners and exposure to different toxicants in our environment, and yet they still just do not feel well. This could be the result of having this gene mutation. 40%, it's estimated that up to 40% of people have either one or the other of the gene mutations, or they are considered homozygous or heterozygous for the various genes. So whenever we get somebody who is actually living a very healthy lifestyle, this is something that we need to take a look at. And so today we're going to talk a little bit more about this gene mutation to help you understand why, when a doctor recommends methylated vitamins, this is the reason why we're recommending them. And so taking a vitamin that you buy at a store typically is not going to help you. It's going to be a waste of money. We'll come back to that again in another video about whether or not you should be taking that multivitamin, especially like the Centrum. Okay. So 40% of the population does have this gene mutation. And it's an underlying component of fatigue, heart disease, anxiety, depression, and some types of cancer. There are two main variants of this particular gene that can be mutated. One is the C677T. The other is the A1298C. And they're just found in different locations, but both of them can affect methylation. And each of the different genes can affect methylation in different ways, and that's another reason why you really want to have somebody who is versed in treating these conditions help you out. For instance, if you have the C677T mutation, SAMe may not be a good fit for you, whereas it may be a good fit for the other component of the other gene that can be mutated. So both of them affect methylation in different ways, and they both infect different aspects of metabolism. And so if you're not familiar with methylation or you've never heard of this before, don't worry. I'm going to break it down, make it into really easy terms, and explain how it works. So first, one of the things we always like to talk about, so symptoms, whenever we talk about symptoms, they are a cry from your body to do something different. So if you're experiencing symptoms, this isn't about, okay, I'm tired, so I'm just going to drink more coffee. That's not going to help this. The underlying problem, if your underlying issue is that you have this gene mutation, you need the methylated vitamins instead of drinking coffee, because coffee is just going to wear you out. In fact, if you look at it from a Chinese medicine perspective, when you drink a lot of coffee, it wears out your adrenals because you're producing more and more epinephrine and norepinephrine, and you're tiring it out, and you don't want to overwork any of your glands. And so even though you might kick out more of those neurotransmitters to try and help deal with it, the underlying cause is really a need for this active form of folic acid. Some of the symptoms that are associated with this genetic defect include fatigue. Often we will see in your family members, we'll see that they have anxiety or depression. Bipolar disease is always been said to be a difficult disease to treat, but a lot of the time it's simply not the case. And, one of my favorite quotes is always, nobody in the world has a Prozac deficiency. Nobody in the world has a Geodone deficiency or any of the other hefty duty medications that they use. They're not fixing the problem when the underlying issue is you simply don't have enough active folic acid. And it can fix a lot of these issues. So then there can also be a family or personal history of cardiovascular disease. So whenever I talk about cardio, you know how I love cardiovascular disease, because most people who are sick, they're sick because of cardiovascular or cardiometabolic disease. So symptoms of this include like blood pressure, strokes, heart attacks, that type of thing. Anybody who has irritability or mood swings should be tested for this. Anybody who has miscarriages, if you've had even one miscarriage, I'd highly recommend getting tested for this. Folic acid, as most people know, is really important for neural tube development in the embryo. So if you don't have enough folic acid on board, the baby's brain isn't going to develop, and that can result in a miscarriage, and it happens really early on. So it's a blessing in disguise as much as you don't really want to have a miscarriage, but simply taking this. And that's why whenever I'm working on women for fertility or women who are wanting to get pregnant, I require them to be on here. And just another real quick aside about folic acid is taking birth control pills severely depletes your folic acid. So it's not really a big surprise when a woman tries to take traditional birth control pills and does not respond well to them. I've heard of women, they start the pill and within a day or two of starting the pill, they become suicidal. I actually had one gal with a gun to her head after just a few days of taking this, and she's like, this is crazy. No, this is not me. And so we had to do some liver detox with her, get her off of this, and it's because it just depleted her. She does have this mutation, and so between the mutation and then when we use the word sequester, it means it grabs it all up and eats it all up. So the birth control pills will do that. And so when you're severely depleted like that, it's no surprise that you can become suicidal, like instantaneously. Irritability, mood swings are common. Cognitive issues, difficulty focusing, brain fog are very common. Again, we keep going back to Alzheimer's and how with Alzheimer's there is difficulty, and this is from years and years and years of having this nutrient deficiency and not having methylated B vitamins on board. And eventually it takes a toll, and it's a pretty serious price to pay. So anybody who has a history of any kind of inflammation related conditions, so that's going to be anything ending in itis, arthritis, pretty much any tissue you have, uveitis, gastritis, any inflammation, anything ending in itis is inflammatory. And again, we're coming back to hormone concerns. So people who've been diagnosed with PCOS, which is polycystic ovarian syndrome, estrogen dominance, endometriosis, a history of painful or troublesome menstrual periods, infertility, miscarriages. I know I've already kind of spoken to some of those. So women who have women troubles, I always think of the woman who had issues of blood and reached out and touched Jesus' garment, and she felt the power flow into her. She may have had an issue with this methylation defect. I can't say definitely she had, obviously, not without testing. Poor response to hormone replacement therapies. We already kind of talked about the extreme swing of a woman on the verge of suicide from taking birth control pills. Elevated homocysteine in lab work. Systemic illness that has developed after breast implants. So anybody who gets breast implants or other implantable devices, so titanium, mesh, any kind of mesh, anything that gets surgically implanted into the skin or inside of the body. We also see this with headaches and migraines. Then we also, anybody who has symptoms of B vitamin deficiency should be tested for this as well. And so symptoms of B vitamin deficiencies include, but they're not really limited to, like pale skin, lightheadedness, dizziness, numbness, tingling of different body parts, muscle weakness, anemia, mouth sores. We really see some severe symptoms associated with this mutation. For instance, suicidality, depression, high blood pressure. And it's especially bad when people eat the standard American diet. So when I talk about a standard American diet, there's basically two very different types of diets that you can classify every other diet in the world on. And of course, there could be a little overlap. So for the standard American diet, SAD, we're looking at processed foods, lacking in a diet lacking in whole foods. And then when we talk about a whole foods diet, so you've got the standard American diet or you have the whole foods diet. When you're eating a whole foods diet, you're eating foods as they appear in nature. They can be cooked. It's a good idea to eat warm foods. So medicine tends to diagnose these conditions only when symptoms are very advanced. We wait until there's such severe cognitive decline that somebody needs to be put in a home a lot of the times before they do anything about it, and the medications are completely ineffective because the disease processes has already, the neurotangulary fibers in the brain and the tau proteins, you see that quite often. It's just gotten so advanced at that point in time. Once there are structural changes, like for instance with blood pressure, people leave blood pressure unmonitored or untreated, or not treated the way it should be, not improperly monitored, not monitored by a physician. And that can lead, this can be an underlying issue for that. And if you leave it, you may eventually get congestive heart failure. And once you get congestive heart failure, cardiomegaly, meaning your heart is too big from pumping so hard and working so hard, because it's a muscle and it gets big if it gets worked really hard. And then you can end up getting congestive heart failure. Not all cases, but it's possible. So, as we've seen, these mutations can cause a range of different health issues, mood disorders, hormonal imbalances. Another one that I didn't really talk about are detoxification problems. Like, one of the lesser known is multiple chemical sensitivity. And these are the people who can't walk down the soap aisle at the grocery store, or they're in a restaurant and somebody sprays some kind of cleaner and they're all of a sudden choking and gagging. And then there are even a few types of cancer that are associated with this particular gene mutation. So people that have this, and it's estimated up to 40%, are unaware that they even have this. It's really crucial to understand the implications. The treatment is very simple, it's very inexpensive, and it can save you from a lot of heartache down the road, a lot of pain. Methylation is a biochemical process, and it happens when a methyl group, which is a carbon atom and 3 hydrogen atoms, is added to another compound. This process is really important for a lot of different bodily functions, and primarily in hormone regulation when we're doing toxin removal, detoxification, also with neurotransmitter production. So it's a double whammy when it comes to mood in that event. Inefficient methylation can lead to all of the symptoms we just talked about, and some of the health issues can be easily reversed in the earlier stages. That's why it's important to start taking care of your health in your 20s. You can prevent a lot of diseases that are going to start coming up in your 30s and 40s, and then the severe decline that we start seeing in 60s and 70s. So people who have these mutations, the MTHFr mutations, they have a hard time converting folic acid into methylated folate. So most of the time when you see folic acid, and in our overprocessed world, foods are heavily inundated with folic acid. How many times have you seen folic acid on there thinking, oh, I'm getting my vitamins? Well, if you can't methylate it, you're not getting anything. So because of all the fortification, nobody is deficient in folic acid, but it doesn't do any good if you aren't methylating it. So methylated folate is critical for producing substances like SAMe, which is a methyl donor, and glutathione, which is the major antioxidant. I've talked a lot about oxidative stress and the contribution that oxidative stress has to a lot of conditions, including cancer. When you have impaired methylation, you'll have increased toxin levels, hormonal imbalances, mood changes, nutrient deficiencies. And one thing that can be really frustrating as a physician is so many people now are just throwing hormones at people instead of taking a look at these methylation deficits. So I think it's really crucial to make sure you're getting enough nutrients on board, because all the hormones in the world, they might make you feel a little bit better, but it's not going to be the same as taking care of the underlying issue, which is really the methylation error. Furthermore, if you have this mutation, if you're not taking methylated folate, then you're going to have difficulty having a healthy pregnancy. And we've already kind of touched on the neurotube defects that can occur. One where it's only a partial is called spina bifida. And you can have everything ranging in a baby when they have spinal neural tube defects to actually having an actual hole there when they're born, which requires surgical intervention in a very severe one if they actually make it past those first few stages, where if they get past the miscarriage space and they actually get to the point where they go into full development. And so they can either have an open thing on their back where the narrowed tube, the spine is exposed in a very severe case, to very mild cases, and more what we're going to see is a little tuft of hair at the base of the spine. What we could also see are dimples. And so that's another physical characteristic that can indicate that somebody has this particular genetic SNP. Let's go into a little bit more detail about the various medical conditions. So in type 2 diabetes, if you have this mutation, it increases the risk of type 2 diabetes, and it also increases the risk of getting complications. Now with diabetes type 2, people don't generally die from diabetes. Generally what they die from are the complications. And when I talk to people about diabetes and why it's so important to make sure they're eating the whole foods diet instead of this SAD diet, is because you're either going to end up blind, you're going to go into renal failure, which is kidney failure, or you're going to start getting gangrene on your feet and start getting things cut off. And whenever I talk to people about diet, it's like, is it more important to have a piece of cake or to have your vision? Is it more important to eat those salty caramel pretzels or not have to go to dialysis every other day so that you don't feel lousy because your kidneys don't filter out your blood anymore? Do you really want to have, your tortillas, or do you want to have your toes? In addition to the diet, however, this is another thing to look at, is this methylated folate, to prevent diabetes. And then if you do have it, it's never too late to start taking methylated B vitamins and to change your diet so that you can not go down that path. And keep your vision and keep your kidneys and keep your toes. How exciting is that? Just eat right and take some good vitamins. It's a no-brainer to me. Not to mention how you're going to feel. You're going to feel so much better if you have all the stuff on board. Vitamins and your methylated B vitamins and everything. You're just going to feel so much better. Anxiety and depression are also very common symptoms associated with these mutations. Often they will take antidepressants and they won't work. They won't help. Or maybe initially they're slightly effective because they are using up a little bit of their stores of methylated folic acid depending on the type of gene mutation that they have. But remember when I talked earlier on, those neurotransmitters like epinephrine and norepinephrine and serotonin all rely on methylation. And so they won't respond very well to antidepressants either, because the antidepressants also rely heavily on methylation to work effectively. Cardiovascular disease. They're linked to a higher risk of cardiovascular conditions, usually hypertension and stroke, so high blood pressure and a stroke. And research has shown that having this mutation increases both the risk of having a stroke and the risk of having elevated blood pressure and needing to be on medications. Again, talking about lifestyle, exercise is paramount, eating a whole foods diet. But again, people who are doing that are still having blood pressure, and they're still, which can lead to strokes. And it makes me so sad to know, because I've worked in a lot of these living assisted homes or like the long-term care facilities, and I can't tell you how many people I've fed and changed their diapers, and then on top of it, instead of giving them methylated folate, they make sure that they take all their blood pressure medications and they live the rest of their normal life in this state, and they're alive, but somebody gets them up in the morning and somebody puts clothes on them and somebody else helps them to breakfast and maybe somebody feeds them, and just no quality of life. And I mean, isn't that really what this is all about, is having a high quality of life? I mean, that's really, and I do need to go through and explain with the loving life, the reason why I named that is treating, you know, if your quality of life is like the most important thing. And I sat when I first became a doctor, and I thought to myself, well, if I want to treat these conditions and their quality of life is horrible, they must be hating life. It's tired of being tired. And then I was like, wait a second, the opposite of this is loving life. That's why I named my practice Loving Life. Because to me, it's all about loving your life, having a quality of life, and enjoying life and enjoying being alive, so that we can give to others and we can serve others. Anyways, let's get back on track. So chronic pain and fatigue. So those were my initial ones, were anxiety, depression, chronic fatigue, and chronic pain. We will often see that people who have these mutations have a higher likelihood of migraines, fibromyalgia, chronic fatigue syndrome. There can be other contributing factors. We'll get into these at some point in time and go into more detail. But today we're focusing on methylated folate. And so anybody who has migraines or fibromyalgia, chronic fatigue, we already mentioned all the itises, arthritis, and whatnot. All of these are painful. Inflammation, there can be associated with this gene mutation, and a simple fix is taking methylated B vitamins. Super easy fix, and it's actually not very expensive. We had already talked a little bit about inflammatory autoimmune conditions. So methylation impacts inflammation and immune function. And so we already kind of mentioned arthritis, but also the interaction between chronic inflammation and autoimmune. Then we see rheumatoid arthritis, which is a very common inflammatory and autoimmune condition that we see. And again, methylated vitamins. And cancer, we also see methylation areas linked to the BRCA genes. And the various cancers that are associated with errors in methylation include breast cancer, ovarian cancer, skin cancer, lung cancer, thyroid cancer, and leukemia. And so anytime I see somebody with a family history of any of these, it's also a pretty good idea to get tested. And the risk can stem because of the impaired detoxification processes. So at this point in time, we kind of are thinking that because you are not able to detoxify your body the way you should, that's where we see an increased rate of cancer. So it's not a direct correlation, not a direct type of thing. Inefficient methylation can also lead to hormone accumulation, and that can also predispose people to hormone-related cancers. And so, like I said, it's when you're really, really young, if you're having symptoms, it's your body trying to tell you, hey, do something about this. And this might be something just as simple as getting on a high quality vitamin like we offer through Loving Life Natural Medicine. So understanding and managing methylation is crucial for overall health, and it's especially important if you have these mutations. So you can monitor your homocysteine levels. That's something any doctor can run for you, so you don't even necessarily have to get tested for this. But if you have elevated homocysteine levels, you're more likely to have this, and it's a pretty inexpensive test. Eating a diet rich in methylated folate can also help with some of these. So where do we get methylated folate? Methylated folate comes from rich, dark leafy greens. It also, if you're doing like iceberg lettuce, like you might as well just go drink a glass of water. Whenever I see somebody eating an iceberg lettuce salad and they think they're doing something healthy and then they dump a ton of ranch on top of it, I'm just like, how about if I save you a lot of trouble and I'm going to go get you a glass of water and I'm going to put a whole bunch of mayonnaise and herbs in it, and that's basically, and then you can just drink that. It's the same. There's like little to no nutrients in that. But if you're eating your dark leafy greens, and that also includes broccoli and spinach and kale, that's where you're going to get a lot of those. Again, you'll gather over time. I am not a big proponent of something like carnivore diet. I know there's one MD in particular that is always going on about how they're eating grass, and so the grass contains these, and so you're eating the meat, and so it has all your vitamins that you possibly need. I can't tell you the number of times I've seen